This is Amber McClendon, Associate Professor with Campbell University's College of Pharmacy and Health Sciences, and the Geriatrics Clinical Pharmacy Specialist here at Glenair to give you a brief, updated in-service on medication errors. We have many opportunities during the medication process for a medication error to occur. It can happen in the prescribing process by providers. It can happen in the transcribing process, which multiple healthcare providers may be involved in. For nursing staff in particular, we want to think about our three-way check every shift following any new orders. We want to make sure that we're reviewing the provider's order, the MAR, and the order that's coming back from pharmacy to make sure that they all match. Errors can also happen in the pharmacy when medications are dispensed or during medication administration, and this is where nursing plays the largest role. So we are all familiar with the 5 rights to make sure that the right medication is given to the right patient at the right time through the right route at the right dose. And then also you have all been in service previously on making sure that you have the right education, that the resident has the right to refuse, that you want to do the right assessment and evaluation. But today we're going to focus primarily on the 5 rights. Errors can also happen in documentation, so we want to make sure that we don't do any documentation on the MAR prior to administration and avoid documenting multiple medications with one click, particularly if they're as needed medications, as often these are not all given at the same time. And then we can also have errors and failure to monitor. Today we're going to focus largely on the administration errors, but we'll touch on some potential transcription errors as well. The biggest study I really found evaluating medication errors in long-term care actually occurred in North Carolina. It's a little older, but it assessed errors that were reported to an electronic monitoring system across 25 different nursing homes, and they found the most common medication errors really had to do with dosing. And in fact, that's a lot of what we've seen here at Glenair, particularly in the last quarter. So making sure that we pay particular attention to doses and that making sure that patients are getting the correct dose can go a long way to reducing medication errors. The other types of errors that we saw commonly across North Carolina were involving the 5 rights. So either being the wrong patient, the wrong medication, or the wrong strength. So that's why we're choosing to focus on the 5 rights today during our in-service. In North Carolina, it was interesting that among the errors that occurred, I think it's easy to think that, particularly if you think about a wrong patient error, that this could be PRN staff that aren't as familiar with their residents or with their medications, but in fact, the vast majority of errors occur with permanent regular staff. And so we can't allow ourselves to become complacent, thinking that we're very familiar with our residents and their routines. We still have to be very vigilant about preventing medication errors, no matter how familiar we are. We also know that nearly half of the errors occur during medication administration, and basic human error is responsible for about half of those errors. So that's why we just want to focus on the areas that we can improve in ourselves and our processes. There are also several medications that showed up multiple times for causing the majority of errors, and these typically are high-risk medications anyway. So if you think about medications like benzodiazepines or opiate pain medications, these have a high risk for having a medication error, so paying particular attention when you're administering those may also be helpful. High-risk medications like warfarin and insulin, which have very narrow therapeutic windows, so there's a small difference between the dose that's effective and the dose that may be harmful to the patient. And then, of course, furosemide, which can affect their electrolytes. So paying particular attention to your high-risk medications may also lead to fewer errors. Now we're going to move on to the 5 rights. And again, most of you are probably familiar with these. Right patient, we want to make sure that when we pull the card out of the cart and go to dispense the medication to the patient, that we're matching up the name of the patient with the correct patient or resident. We know that oftentimes the photos that are kept in MyUnity may not be up to date and give us the most up to date or even healthy photo of our residents, but we want to make sure we're doing all the things we can to verify the identity before we administer any medications. For this particular patient, her name is Betty White. We can see her photo here in the chart and then her in real life. But what if this patient, the order or medication label read for Rose Nyland? Would that in fact be the right patient? I'll allow you to consider that on your own, particularly if you're familiar with the Golden Girls. Right medication. So we just want to make sure that the medication order that we have, or even the MAR, and here we've highlighted Eliquis, matches the medication that pulled out of the cart to dispense to the patient. And in fact, this medication is Eliquis as well. Right dose. Again, this was one of the common errors in North Carolina, and in fact, this has been a common error for us here in North Carolina. So if we see here, the order was for fentanyl 25 micrograms per hour, 1 patch. And this patch here, and my no symbol came up a little early, but it's here over a 50 microgram patch. So that would be an incorrect strength. And the interesting thing about patches is that we have the ability to check it in 3 different ways. So we can look at the pharmacy label. So here it says 12 micrograms per hour. So that's also incorrect. We can look at the box itself. And even though you don't know it, this says 75 micrograms per hour. So we could look at the label, the patch itself, or the patch wrapper, and the box to double check. And this is one of the errors that we recently had at Glenair, where a resident was given the wrong dose of a patch. So noting that, just make sure to check in all the areas that you have available that the right dose is being given. Another example of a right dose error could be an order for Keflex or cephalexin 1 capsule, and we can see the directions are for 1 capsule, but perhaps the pharmacy package 2, or you accidentally punch out 2, and you want to make sure that the patient isn't receiving 2 of those capsules, even though a common dose for a lot of patients may be 500. We want to make sure that we're double checking and that the patient is only getting 1 capsule, which is the dose that they're intended to get. And this is another error that we had recently at Glenair. So again, paying particular attention to doses, especially for something short term like an antibiotic. It's probably new to the routine, or any new medications. Those are high potentials for an error to occur. We also want to think about the right time. Now, luckily at Glenair, we have undergone culture change, and most of our residents have pretty open windows for when medications can be administered that are unique to that individual resident. But for those medications that are tied to a very tight time schedule, we want to make sure that they're given within that appropriate hour before or hour after range. But we also want to think about the right time as far as when the order was started. So this goes back to transcription. So we want to make sure if any meds are recommended, that they are coming in from the pharmacy and being started on time, or that if a outside recommendation or prescription has been ordered, that it's being entered into the system on time so that the patient not only starts it at the right time of day, but on the right date. And this was another error we had recently, where a medication was not started for 10 days after it was recommended to be ordered. Right route. So you may think here with the Spiriva capsule that it could be given orally. However, we all know that this is a capsule placed inside of the HandiHaler, and then the contents are punctured and inhaled into the lungs. So not an error that we've seen, but definitely a potential for an error to occur. In conclusion, recognize that anyone has the potential to experience or participate in a medication error. Pay careful attention to the 5 rights for each medication, and this can help minimize errors. Note high-risk medications, short-term medications, or new medications as potentials for medication error, and make sure to report all medication errors, which help us to improve our overall systems and minimize future errors. Thank you so much for your attention.